Suffering from sciatic pain, it sucks. I'm going to give you the ways to get relief quickly. On the internet, here in YouTube, you're going to see so many different things, and they usually start with exercises and stretches, and I'm going to tell you right now, because I've had sciatica, they make you worse. And if you're trying them from a different video, you know what I'm saying. It gets worse. I'm going to help you without getting worse before you get better. You're just going to get better. Now, the 4 main causes of sciatic pain is compression from muscular tension, degenerative disc disease. Doctors, chiropractors, PTs, they love to throw that diagnosis around. It's not as scary as it sounds, by the way. Stenosis, that's the narrowing of the holes that your nerves go through. So if the hole gets smaller, puts pressure on the nerve, it gets irritated. And then, of course, bulging, herniated, or ruptured discs. Those are the 4 main reasons you're going to get sciatica. Sciatic pain starts in the spine, comes out the side of the hip, down the middle of your hamstring, and out the side of your knee, calf, down to your ankle, and then it ends up under your big toe. It is the same size as your pinky. It's the biggest, fattest nerve in your body. So when it's irritated, it's really irritated. The one thing to remember today is to decompress everything involved, and you will get relief. If you stick on this video to the end, I'm going to show you exactly how to do it, and you will get relief in 1 or 2 minutes, guaranteed. So there's a ton of exercises. Some of the ones you're going to see, child's pose. I do not recommend this because most people don't have the mobility in their hips to get into child's pose without rounding their spine. Anytime you bend your spine and hips forward, you're creating compression within the body. Compression within the body aggravates sciatica. The other one you're going to see is cobra pose, and you can modify cobra to be better. And the way you modify a cobra is think before you go into extension, lengthen the spine, open up the front of the hips, lengthen the spine, and then go into extension. And then cobra will take pressure off of that bulging disc. The other ones that I don't recommend if you have sciatica right now are the figure 4 stretch, which looks like this here, and we're stretching the hip here. What are we doing here? We're flexing the hip, and the more we pull, we're flexing the spine, which is also compression of the system. And last but not least, nerve glide. You could do it in a chair, but they're often demonstrating it here. This position already is going to irritate your sciatica. So do not do the nerve glide ankle pumps early on in your treatment. Instead, do this. I call it resting position, spinal decompression. For more help, just jump into the description for my full video of decompress at rest, spinal decompression. It's a detailed tutorial on what we're about to do right now. Relief coming your way right now. You will need 2 pillows, one for the neck, head, and shoulders, and one for the knees. To troubleshoot, you will need a rolled up hand towel. We're going to start without it, so we're just going to tuck it right here. And now to get into position, you simply lay down on your back, knees over the pillow. Let gravity roll your knees out so they're externally rotated. Externally rotated hips unloads the pelvis, which then takes pressure off of the lower back or lumbar spine. Now, if you can, roll up and push your elbows down, creating space here. If you can't, it's irritated, you don't want to do it, just scoot your shoulders up one at a time. The leading edge of the pillow should be around your armpit. From there, you're going to lay back, and you should feel gentle traction through the lumbar spine. Within 1 minute, literally 60 seconds, you should be getting relief. If you don't get relief then, or there's more numbness or tingling, you simply take your rolled hand towel and you're going to place it right across your waist. And that will simply open the last lumbar L5, S1, the last lumbar joint, to decompress it further. And then 1 to 2 minutes, you should have relief. If you get relief from this, keep doing it. You can stay in this position for 10 to 20 minutes. When you get up out of the position, roll to your side and get up. Because like we talked about, from here, if I do a sit-up, that's flexion of the hips and spine. That's more compression. Instead, roll and get up easy like that. And then we'll go over more things to decompress your spine, get rid of sciatica fast without any of the flexion and compression that causes it that you've seen in every other video. If you're ready to get fully decompressed and total relief from sciatica permanently, jump in the description and get into one of my courses.